So the next thing that we are going to do is a dermatomes and myotomes assessment. First, you can have them just stand up and then perform the movements with you. You want to make sure that they can perform the movements, then you can add and progress to a resistive adding the movements. Anything that they cannot perform is a diminished or nervous system pathology, and you want to make sure it gets checked and you send them. And a lot of the times too, if they don't have all their cranial nerves or dermatomes or myotomes, and it's like at a football game and they're on the ground, that's when you would immobilize them and call for EMS and hold C-spine. So the first one that we're going to do is C1, C2. So I'll do all the movements and she'll repeat them. So C1, C2 is neck flexion. C3 is neck lateral flexion. C4 is shoulder elevation. C5 is shoulder abduction. C6 is elbow flexion, wrist extension. C7 is elbow extension, wrist flexion. And C8, you just add to that C7 and add ulnar deviation. And then T1 is AB and adduction of the fingers. For the lower body, we have L1 and L2 are hip flexion. L3 is knee extension. L4 is dorsiflexion. L5 is great toe extension. S1 is plantar flexion, eversion, and hip extension. And S2 is knee flexion. So now you will repeat all of those and add a resistance to them. So C1, C2, C1, C2, and they will try and keep down, and I will provide resistance to try and pull them back. Good. C3, you'll try and pull them out of that. C4, shoulder shrug, so I'll provide resistance. C5, try and get them down. C6, so you'll try and extend and flex. C7, C8, good. And the resistance will just be provided the opposite way, so you'll do the opposite action. T1, so abduction first. I'll try and adduct fingers, and then also with a deduction, and now I'll try and abduct them and pull them apart. L1 and L2 is hip flexion, so I'll try and push her into hip extension. L3 is knee extension, so now I'm going to try and push her into knee flexion, and she'll resist. L4, dorsiflexion, and she can be seated for these. Dorsiflexion, so now I'm going to try and push her into plantar flexion. L5, great toe extension, so I will try and push her toe into great toe flexion. S1, plantar flexion, eversion, you'll stay up for this one. Plantar flexion, eversion, hip extension. So hip extension. So now I will try and push her into dorsiflexion, inversion, and hip flexion all at the same time. Good. And then S2 is knee flexion. So I will try and put her into knee extension. Good. So she passed all of those. Again, anything finding, usually you will be performing these as one of your checklists for C-spine. So anything diminished or abnormal, or if any of those inflicts pain on the patient, you will C-spine them. The next thing is dermatomes. So you will use either one of these handy dandy thingy-mabobs. This is a needle. It can also be a reflex hammer that has accessory stuff. This is a needle, so you use this as a sharp sensation, and then I'll use this little ball as the smooth sensation. So for dermatomes, you hit all of where the cranial nerves are, and you basically will have them close their eyes and hit them with either the sharp or the smooth and have them differentiate. And again, this is also used as a checklist for C-spine. If they cannot feel what you're feeling, then that is a problem, and that's when you'll C-spine. For dermatomes and myotomes, you will always compare bilaterally because that will help you as well. So you'll hit all of them, so just literally go up and down the body from L1 to all the way down S1, S2, C1 to C8, S1, S2, T1, all of the above. And you'll just go bilaterally, kind of randomly. So you'll just sit there and I'll say, tell me when you feel sharp and tell me when you feel smooth, and just yell smooth or sharp out loud. So we'll go
Sharp, sharp. Smooth, smooth. Smooth. Sharp, sharp. Smooth. Sharp. Smooth. Sharp. Smooth. Smooth. Sharp. Sharp. Smooth. 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 Sharp. Sharp.
And you'll have them take off their shoes, so if you don't want to take off your shoes, and do all of them down
Smooth.
here.
Sharp. Smooth.
Some of the other ones that we didn't cover are the belly button ones, so the T's, so T1 all the way down to T10, so you'll still do
Smooth. Sharp. Smooth.
and posterior.
Smooth. Sharp. Smooth.
And like I said, you'll hit all of them and then assess bilaterally. Now we're gonna do a cranial assessment. So one thing that is important is that you'll wear gloves for these. And you're basically gonna palpate all the bones of the upper spine and the head, and you'll check for like pain on palpation or any crazy symptoms that arise. So you'll palpate the frontal bone, the nasal bone, the zygomatic, the eye sockets, mandible, maxilla, occipital, temporal, parietal, and then you'll palpate all along C-spine. So up here at like C4, 5, 6, 7, 8. And for all of them too, you're also checking for any deformities. And the main reason why you are wearing gloves now is because you're gonna look for any type of bleeding. So you'll look in the ears, and you can even use one of these handy dandy little flashlight things. You'll look in the ears for any bleeding. You'll look at the eyes for any bleeding, the nose, and the mouth for any bleeding or any crazy symptoms.